Clinically suspected cardiac amyloidosis has been a difficult diagnosis to confirm. Now in JACC, a group of researchers from Stuttgart and Tübingen in Germany report that cardiovascular magnetic resonance imaging might help with this problem. They compared non-invasive NMR imaging to endomyocardial biopsy in patients with heart failure and restrictive filling, a pattern characteristic of cardiac amyloidosis, but one also difficult to verify, especially in the presence of associated left ventricular hypertrophy. 33 patients had both cardiac MRI and endomyocardial biopsy performed, and cardiac amyloidosis was found in 15 of the 33 patients by biopsy. In those 15 patients with biopsy-proven amyloidosis, cardiac MRI revealed a distinct pattern of late gadolinium enhancement in 12, which was distributed over the entire subendocardium and extended in varying degrees into the neighboring myocardium. This contrasted with only one patient which had this pattern on cardiac MRI in the other 18 patients without biopsy-proven amyloid. This gives a sensitivity of cardiac MRI in diagnosing amyloidosis of 80% and a specificity of 94%. The positive predictive value was 92% and the negative predictive value 85%. An accompanying editorial points out that the story is not finished. There is still much to learn about late gadolinium enhancement and how it pertains to the type of histological changes and the extent of disease burden, as well as its predictive value for complications such as arrhythmias, but does find that there is evidence for the utility of cardiac MRI in helping to diagnose clinically suspected cardiac amyloidosis. I'm Peter Block, and this is a CVN News Brief.